Clients ask us all the time, how is the local healthcare system in Delaware? It's an extremely important question and something you should absolutely consider when you are making a move. If you watched my last video, you know that I am currently recovering from a meniscus root repair. So I thought I would share with you my own personal experience with the Beebe Healthcare System and the healthcare system in general in Delaware. So I have to back up till the end of last year. I was in a car accident in the Ocean View area, and ever since then my knee has been bothering me. I started seeing Dr. Kane with Orthopedic Associates of Southern Delaware. I chose Dr. Kane because surgery is definitely not his first option. It is very much the last resort. The first stop, as expected, is an x-ray, and I love the fact that the x-ray took place right there in his office and he is able to get immediate pictures. There was no broken bones, which we didn't expect any, so the next step was an MRI. And the one thing I really liked about that as well is that they reached out to me to schedule the appointment. I didn't have to keep calling somebody and trying to get through. That whole experience was also very simple and efficient and took place in about 1 week's time, and the tech was extremely kind and patient since I am very claustrophobic. Now, based on the MRI, there wasn't any obvious reason for my pain. And at this point, you're probably thinking to yourself, well then, why did you have surgery? But I will tell you in just a moment. So we went the route of physical therapy and 4 rounds of shots. And after about 6 months, I was feeling a lot better. I had taken several months off from the gym while going through all of those because I really wanted the injury to heal. But I was extremely anxious to get back to the gym. And in a future video, I am going to share with you my gym and why I love it so much. But back to my knee. I started back to the gym, and on day 2, pop! I knew right away something was wrong, except it was my other knee. Fortunately, I had a follow-up appointment with Dr. Kane that same week, but we had to switch gears and insurance and another x-ray and another MRI. And not only did I tear my meniscus, but I tore it at the root. This means a much harder and longer recovery. I was fascinated, though, to find out that a lot of information on this type of root repair has just surfaced in the last 5 to 6 years, so that was interesting. The MRI showed my cartilage was in really good shape, so I was an ideal candidate for this surgery. And as I discussed in my last video, why do we wait until the time is just right? There is never a good time to have surgery. I decided I wasn't going to wait. The sooner I had the surgery done, the sooner I would be back at the gym that I miss and love, and the sooner I would be back to normal. And the sirens are right on cue as we're talking about medical system. So Dr. Kane's office scheduled the surgery. The hospital reached out to me. Again, very simple. They set everything up, including the pre-op questions, the required pre-op COVID test, etc., etc. 1 week later, 1 week took place at Beebe's Outpatient Surgery Center in Lewis, and every single nurse, staff person that I encountered was top-notch. They were kind and patient and professional. I can't say enough good things about them. The surgery itself is relatively straightforward. I always like to try to stay awake as long as I can for some reason with anesthesia, so I remember them playing Journey as I was being wheeled in, and then that's all I remember. The doctor drills a hole in my tibia and stitches the meniscus back in place, and next thing you know, I'm waking up and get to have chocolate chip cookies and ginger ale. The post-op nurse went through the instructions with me and my husband, and thank God for my husband. Truthfully, I could not do this without him. He's an absolute godsend. So at this point, it's time to go home. They do not let you stick around and have a nap. It is up and out. The actual recovery from this particular surgery is far worse than the actual surgery, though, because it's 6 weeks of non-weight bearing. And by the way, I live in a 3-story home, but that's a video for another day. I was sent home with a leg brace that keeps my knee from bending and the most amazing ice system. I have to look up the name, but it'll be up here in the video. It works as part compression system and part ice. And of course, crutches. Haven't used them since I tore some ligaments in high school, so that was a long time ago. Dr. Kane wants you to start physical therapy immediately, which is great. I contacted Premier Physical Therapy since that's who I used for my other knee. They were kind enough to squeeze me in for at least 1 day that week to get started. I met with Rick Beeson, and he was so kind and patient, I knew right away I was in good hands. Both Premier Physical Therapy and Orthopedic Associates happen to share the same floor of a fairly new building in Lewis, so it's very convenient. And a few things I love about the location, besides being very convenient to where I live, there's an elevator, of course, and it's just very clean and very bright. I went back to Dr. Kane for my 2-week follow-up. Everything is going extremely well with my knee. Thank you. I have near zero pain. The biggest hurdle, honestly, is just the crutches. And did I mention the 3-story home? I was given pictures of the inside of my knee. Oh my gosh, super cool. I go back in 4 weeks for the next follow-up, and in the meantime, we'll continue twice a week physical therapy. In 2017, I had surgery at Beebe Hospital, and my experience was the same then. Everyone I encountered was extremely kind and professional from beginning to end. So with all that being said, my personal experience to date has been absolutely wonderful. Do we have facilities like Johns Hopkins or Temple University? No. And if you ask Dr. Tam, Beebe Healthcare's CEO and president, we're not ever going to be those types of locations. Their goal here is to have the best possible healthcare for your day-to-day needs and some of those major healthcare needs such as orthopedics or a heart attack. Beebe has added more than 100 physicians and providers in just the last 2 years, including a wide range of specialties from primary care to surgeons. Our son-in-law works in cardiac rehab at Beebe Health, and I know they are looking to expand. And God forbid you're in a really bad accident here somewhere in Sussex County, they'll send you via helicopter to Christiana in northern Delaware. In 2016, my husband was diagnosed with cancer, and it changed our lives forever. His doctor was completely honest and upfront and said the type of surgery you need is not available here, but I'm going to refer you to the top doctor at Temple who specializes in this. So for the next 2 years, we traveled back and forth to Philadelphia for various surgeries and follow-ups. Even if the care you need is not literally in your backyard like it has been for my knee, it's really never more than 2 hours away. So in summary, I have been extremely pleased with the care I have received from my primary care doctor at Beebe Healthcare to the physical therapist at Premier Physical Therapy and just everyone in between. If you know for certain you are moving to Delaware, do your research ahead of time and get an appointment for your new primary care doctor or dentist. In some cases, there are long waits, and in other cases, you can get in pretty quickly. Wherever you decide to move in Delaware, though, we have agents ready to assist you throughout the entire state. Now go live, love local, and preferably Delaware is going to be your new local.